All right. As I said, good morning. Thank you everyone for attending this survivorship lecture series. For those who haven't attended before, the lecture series was conceived by myself in 2020 or 2021. It's been going this is the fourth year of the survivorship lecture series. I tried to do sessions monthly. Sometimes that doesn't work out. And it's all about topics in survivorship. So individuals in and adjacent to treating cancer patients, whether it be doctors, nurses, PTs, OTs, social workers, as we have today. So I'm going to go ahead and introduce our speakers. Myself, I'm boarded in preventive medicine, and I've been working with the UI Cancer Center for over 4 years in cancer survivorship, starting as a fellow in 2019. My role on the survivorship and prevention team right now is primarily in education of providers and patients like the survivorship lecture series. The other speaker with me today is Jill Otto, LCSW, Certified Oncology Social Worker, and she's been supporting social work programs for 35 years. She previously worked at Wellness House for 4 years prior to joining University of Illinois Health in 2023. So I'm going to go ahead and share my screen. We will give our talk and then hopefully have time at the end for some questions and comments. So here we go. So this is a talk that actually was originally conceived and I gave for the Illinois Department of Public Health, giving it a little bit more meat and a little bit different perspective with Jill being our social worker today. So this is us, myself and Jill. I introduced us. Our emails are here. And I want to point out that I am a previvor, meaning I have a genetic predisposition to cancer. So that kind of led me into the field. And Jill is a cancer survivor, and she can talk more about that and how that shaped her path in this field. But we want to talk about mental health in cancer survivors. First, we want to establish the importance of this issue among survivors, and then review common mental health issues that are encountered by this population. We'll explore some strategies that help survivors manage their mental health issues, and then discuss current developments in the area of mental health for cancer survivors. So a lot of people don't actually know what a cancer survivor is. Most folks that if you ask them, what does this term mean, is they'll say when someone's finished treatment. And actually, the National Cancer Institute defines it actually not as that, but from the time of diagnosis. Because at that point, you really don't know how long a patient has had cancer.
UIC is now starting survivorship a little bit, right? This is where
I'm trying to get my.
you know what that is.
Sorry, guys. I have
Lava.
Okay. And so yeah, cancer survivors are really throughout the whole span of diagnosis and treatment and through the balance of their life. So just imagine for a moment getting a cancer diagnosis. Some of you may have, and it's so many emotions and so many different fears and anxiety, and everything is running through your head rapid fire. 1.2 million people are newly diagnosed with cancer every year. And every 30 seconds, a new cancer is diagnosed. So this is a large population. There are 18.1 million cancer survivors in the United States, which is a little over 5% of the US population. So almost everybody knows someone who has been impacted by cancer. This is a very popular graph in cancer and cancer survivorship. You can see the year now, it's about 18.5 or 18.1 million, but it is projected by 2040 to increase to 26.1 million. So it's a rapidly growing population. And you can see a large amount of that population is elderly population because our treatments are getting better. But we need to focus on survivorship because cancer survivors may experience myriad symptoms, these lots of different symptoms. I'm not going through all these today, but this is a lot of what they experience and obviously needs to be addressed. And these symptoms can persist over the long term, or they can just pop up and arise anytime, some happening 5, 10, 20 years out from the cancer diagnosis. And you can understand how this can be very distressing for patients with cancer. So supporting mental health of cancer survivors is a vital part of our care. All these different psychosocial issues and different domains interplay together. And sometimes you're not thinking about all of them. You'll have the obvious physical components, but also give social components, relationships, psychological, anxiety, depression, and spiritual plays into the mix as well. Mental health issues that survivors experience are all of these things. Distress is probably every cancer patient that you encounter. There are many things to be distressed about, including this whole list: grief and loss, role in identity changes, anxiety and scanxiety, which is when a cancer patient is going for a surveillance exam and they don't know if the cancer's returned, right? So they are very worried about those tests. Cognitive impairment or the chemo brain, depression, fear of recurrence, also something majority of survivors experience. Post-traumatic stress, body image issues, social isolation, and all of this can lead to emotional exhaustion. And it's not enough that there's just these mental health issues. They're all compounded by all these other components like fatigue, insomnia, pain, not getting enough nutrition or having too much, pre-existing conditions like other mental health disorders that patients may already experience. Weakness, nausea, low activity or exercise, which may be a result of disability, strained relationships, and even financial stress. So it's important for cancer survivors to build a robust support network. This is one of the most important factors to a patient's care and outcomes. The association, there's papers on the associations of social networks with cancer mortality. This meta-analysis from 2010 looked at 87 studies on the associations of perceived social support, network size, and marital status with cancer survival. And they found that having high levels of perceived social support, larger network, and being married were associated with decrease in relative risk for mortality of 25, 20, and 12%, respectively. This is not the only study like this. You could find probably a dozen more that cite this very same thing. So how do you do this? Who's part of the support network? And really, it's everyone. Your family, your friends, caregivers, even your pets can provide emotional support. Like here, we can provide healthcare professionals, the doctors, APPs, nurses, and navigators. And it's important for all those people and patients to have open communication between them. We can bring in the mental health services to help further assist with this. And this is where Jill takes over. So counselors, social workers, wellness practitioners, and therapy, including CBT, stress reduction, and coping skills can be very helpful. Sorry, did someone have a question or something to say? Okay. these themselves. So there are support groups, which connecting with other survivors can be beneficial. There are many that are available through many different local or national organizations or online groups that you can join. And then community organizations really offer a range of support, including things like mentorship, support groups, exercise programs, transportation services, and a lot more. And just to give you tip of the iceberg, these are not even all the groups in Chicago and Chicagoland, but these are some of the prominent ones that Jill will get into a little bit more later. So helping patients to build resilience and coping strategies to deal with everyday life as a cancer survivor is also very important. In this article about empowering cancer survivors in managing their own health, they had a group of patients that had an opportunity to build and embrace their own new normal. And doing this and assessing them along the periods of the study, they allowed these and engaged these survivors to be more active and involved in their own care. And as a result, these survivors were more able to manage with everyday life with symptoms. So these are important strategies. Things like mindfulness-based stress reduction can actually have improvement of psychological outcomes and quality of life. In these 17 studies on MBSR programs and quality of life, it significantly relieved cancer-related fatigue and negative psychological states. It also enhanced positive psychological states and improved overall quality of life. So the authors recommending MBSR as a part of a cancer rehab program. And there are many strategies like this that are very So another thing you can talk with cancer patients about, and we all should talk to cancer patients about, is lifestyle. Because this is one of the easiest to modify risk factors for cancer. In this review article from 2015, they reviewed 93 articles from 1903. Yes, there was an article about how tobacco might be linked to cancer risk in 1903 up to 2015. And they compiled all the cancer risk associations of tobacco smoking, alcohol consumption, obesity, physical activity, diet, and reproductive and hormonal factors. And suffice it to say, all these things led to an increase in cancer risk without getting into the nitty-gritty details. But I was really impacted by this quotation. It has been argued that half of all cancers in industrially developed and affluent societies could be avoided by non-smoking, reducing alcohol consumption, weight control and physical activity, a plant-based diet, and breastfeeding. So if that's not a ringing endorsement, I don't know what is. I want to also say there are many articles about lifestyle and cancer risk, and there's lots more happening in this area. So changes that can make a really big impact for survivors are making sure they get enough sleep, having a healthy, varied diet, move more and sit less, get more activity, quitting smoking and drinking, of course, implementing coping strategies to help manage your stress better, and then to foster and maintain your support system and build that. So this is from the American College of Lifestyle Medicine. Yes, there's own certification to be in lifestyle medicine, and these are all the things that they promote: eating plants, keep moving, sleep well, be present, stay calm, and love people. And I want to just note that yes, sometimes we will prescribe medications for certain patients depending on the situation, and a low dose antidepressant can be beneficial. If there's anything more needed than this, we will refer to appropriate individuals. But patients can also benefit from supplements like vitamin D and fish oil, or herbal agents like ashwagandha or St. John's wort. And occasionally, we can prescribe anti anxiety or meds to help focus. But again, this is in certain special cases. In all cases, we always encourage cancer survivors to follow with a primary care doctor, again, to just enhance that support network and for care continuity. Finally, I just want to mention treating cancer patients is a multidisciplinary type of approach. They benefit the most when the whole team is working together, and that includes everyone involved, the caregivers, the survivorship team, which we have here at UI Health. If you don't know, we have our own clinic, our own team, and you can get in touch with me if you want to learn more. Primary care, palliative care is very important. Psychology and psychiatry and social work when needed, and also even integrative and wellness practitioners. So now I want to hand it over to Jill, who will offer her own perspective. Are you there, Jill?
Thank you. Sorry, took a moment to get off of mute. Good morning, everybody. I'm so glad to be here with you. And thank you, Dr. Manst, for inviting me to join in this presentation and discussion this morning. And I am approaching this from an oncology social work perspective. And also, as Dr. Manst mentioned, I am a survivor myself, and I am 18 years into survivorship. And many of us here have been touched by cancer in a very personal way, either in our own lives with our, friends, loved ones. And for many of us, it really fuels our passion in this work and gives us some insights and perspective of what patients might be experiencing. So just wanted to mention some of the things we do in oncology social work, providing psychosocial support, assessment of mental health needs, resource navigation, addressing the concrete needs and barriers to care that patients experience. And we really strive for a collaborative approach with healthcare teams to address patient needs, which is really wonderful with providers and medical teams sharing with us, hey, this patient needs this, and also we're doing the same and having those communications back and forth. Just a little bit deeper dive into cancer and mental health. So there's a really high prevalence of mental health concerns with those diagnosed with cancer. And depression and anxiety are the most common, with depression being the most common, and then anxiety behind that. However, I think in presentation in clinic, we see a lot of anxiety. And I would say probably see more of, anxious behaviors and those kinds of things. And Dr. Manst talked about all of these reactions that, of course, people have in response to a cancer diagnosis. And the point at which that becomes a mental health concern is when it's really impacting their ability to function. It's impacting their quality of life. It's impacting their ability to engage in treatment. This is where we're moving into the area of diagnosable concerns, and you can kind of read through some of these statistics here. I wanted to specifically mention that the suicide rate is higher with cancer patients, 20% higher. There's more and more research being done in this area, and the highest risk for cancer patients to die by suicide is in the first year after diagnosis. So when we're thinking about survivorship broadly, it's at that earlier end, and some studies really focus on the first 6 months actually. So that's just a reminder for us to really be alert and aware, that it's not necessarily just somebody is feeling sad when they're saying, I'm just, I'm over this, I can't do this anymore, would require some additional questions, and then possibly referral for further evaluation, because we want to err on the side of caution there, certainly. And only 10% of cancer patients are referred for mental health support, despite the fact that this is such a prevalent concern. Next slide. So thinking about some of the risk factors, interestingly, some diagnoses have a higher prevalence of mental health concerns, and breast cancer, head and neck cancers, pancreatic cancers are among those. I think breast is somewhere at 47%, head and neck at 42%. These are very high percentages. And similarly for suicide risk, there are some diagnosis-specific compounding risks. And so it's important for us to kind of learn more about that so we can be better prepared to support our patients. Some of the other risk factors for poor mental health outcomes include isolation, which Dr. Manst talked about quite a bit, poor social support, low income level, which many of our patients here at UI Health are experiencing, a cancer recurrence or advanced stage cancer, being single or divorced. So that again kind of relates to isolation and having to manage things more on your own. Chronic pain, high levels of pain that won't recede. It can be very debilitating and have emotional impacts, mental health impacts, and also a history of mental health disorder. Next slide, please. And something that Dr. Manst talked about was the interplay of different factors related to mental health with cancer patients. And I wanted to revisit that because it's really important. It's not a one-directional kind of relationship. So we're talking really about how cancer impacts mental health. However, mental health also impacts cancer outcomes. So for those that are struggling with mental health concerns, they do have poor outcomes and have a lower trajectory of survival. So if everybody could please mute, I'd really appreciate that. So thinking about that, it's a complex sort of interplay here with also the social and financial resources playing in, which lead overall to some higher risk of mental health concerns, and cancer can exacerbate prior mental health issues. So there's a lot of factors playing in here. And so any individual is experiencing many different things going on at the same time. And so just noting the complexity of it, wanted to reference back to my early social work days of the Maslow's hierarchy of needs, because so many of our patients here at UI Health are struggling with basic needs and just meeting their needs for food, for housing, just very basic kinds of things. And because of that, they don't always have the time and resources to address some of the mental health issues that might come up, and they may be really lacking support and definitely lacking access to that support. So that brings us all into the equation to really provide stronger support for our patients in this area. Next slide. So in thinking about the impact of cancer, I wanted to mention how we often see this presenting in clinic. So this would be here at the OCC Cancer Clinic, at the Survivorship Clinic, how we might actually see mental health issues presenting. And oftentimes it's avoidant behaviors, high cancellation rates. We're often consulted because a patient has canceled 4 or 5 different appointments, maybe in a row, and can you assess and see what's going on here? And often that's tied with some mental health concerns of anxiety or depression. So very important for us to check those things out. Patients may present with high frustrations, may have a kind of a shorter fuse, and in that sense not be as warm and fuzzy to work with. And it's understandable that medical teams would be somewhat frustrated. We all have our own reactions, but if you're having a reaction to a patient, it's a sign to be thinking about this patient may be needing some mental health support. Also, there may be excessive communication, all kinds of calls or messages in my chart, and the team can't even keep up with it, and is a little overwhelmed, or conversely, no communication. Doesn't show up, won't return calls, no communication, and may fluctuate between those two. A lot of emotional distress may present actually at the visit. And so our teams here are so amazingly good at noticing that and connecting patients with support when they're seeing some obvious signs of distress. Also, sometimes just a very flat affect. So not engaging, very limited responses, no facial expressions, minimal, just kind of a depressed affect is another thing to look out for. Next slide. Wanted to just mention a patient that I'm working with right now. I'm going to refer to her as Lena, and she has a lot of compounding factors that we have referenced earlier. So she had a prior history of some anxiety and primarily depression, and then she has a recurrence, and she's coming into our care here with some trauma from the original diagnosis and the surgery that was really, she did not have appropriate medication for managing her pain, and she was in extreme distress, and it was very, very traumatic for her, as well as the recurrence, which she feels really could have been avoided with appropriate care at another institution years back. So she's coming with all of these kinds of this history that is already predisposing her to some mental health issues. And so she's really feeling a lot of overwhelm. She's feeling very stressed. Anxiety is through the roof, a lot of depression, difficulty sleeping. And so what I'm working with her on is connecting her with resources, and we are kind of that bridge. That first photo is, we're often the bridge to the resources for our patients. With oncology social work, we're really striving to do that. However, it's difficult to connect patients with therapy resources and psychiatric resources often. And so we'll talk about some of the other things that we can bring to the mix. And Lena is currently engaging with Wellness House, and she talked about her first support group that she attended as a life-changing event. Just made the hugest difference for her in understanding that she was not alone. Next slide. So thinking about this prevalence and these impacts, it's really important for us to be assessing mental health needs. And this is also something that is coming out in the literature as a real need for oncology settings to be doing. And most patients will not report mental health concerns unless they're asked about it. So we want to be alert for those behavioral cues we talked about earlier. And also, we want to use screening tools to help in this process. Next slide. And this is our NCCN distress thermometer and problem list that we are implementing at the OCC Cancer Clinic here. So we're doing this with all patients. It's self-administered. And for any patients that are scoring a 4 or above, they're referred for social work support. 7 and above, they're getting some day of support, or that's being offered to them. And then we also, with a problem list, if they have high list of problems, then we are providing some support, some outreach and support. This is our survivorship assessment. And this is really wonderful. So beyond treatment and in that longer term survivorship realm, we have all of these questions that we ask patients to help give us an idea of what their needs are from just a holistic mental health perspective. Next slide. So wanted to revisit interventions and support strategies because Dr. Manst referenced these, and she talked about the mindfulness-based stress reduction as evidence-based, and we know that relaxation techniques can be very, very helpful. And Nina, that I referenced earlier, I actually emailed her some relaxation resources and some apps and that kind of thing. And she was able to start using some of those strategies. Not all of our patients will be able to, work from a document to get some help and some relief, but many will. So be thinking about these other kinds of approaches to helping with distress and supporting resilience for our patients. Just noting some of the strategies that are utilized in therapy here. Next slide. Next slide, please. Thank you. And I wanted to mention the 4 M's of mental health. I don't know, I'm thinking some of you have heard of this before. Dr. Sue Varma got a lot of airtime on the news after the pandemic began. And she's a psychiatrist, and she had this wonderful way of simplifying things that are evidence-based that we can do to increase our mental health. And the first is movement, and that does not have to be rigorous exercise. Just getting up and moving can help us feel better, helps our brains start functioning in a different way. And with our patients, we can be talking about that. How are you moving right now? Are you able to get around and walk? Some of our patients have real limitations with their mobility, and so the movement might be stretching. It might be, more in a chair-based kind of a way. But any movement is really, really helpful. Mindfulness, we've kind of touched on this several times already, and I can't say enough. Mindfulness is so helpful as an antidote to worry and anxiety, which is really that worry about something terrible happening on the horizon. It's not here yet, might happen, it might not happen. It brings us back to this very, very moment. And so mindfulness is really about noticing the moment without judgment and just being in the moment. And we can do that through simply paying attention to our breath. There's something called square breathing, where you breathe in, hold, breathe out, hold, and you're imagining a square as you do that. And that can help us to calm. Just even taking 5 deep breaths can help us to calm and help us focus on our breathing, which brings us into the moment. Mastery is doing something, getting something done, feeling like you've accomplished something. And so it doesn't have to be a huge project. It might be for our patients calling somebody else to see if they need some support right now, and then feeling really good about that. They've accomplished that. Or maybe they'd want to keep a list of some things they'd like to get done and mark it off as they go and remind themselves, congratulate yourself, you mastered that, you did that, that's important. So getting some things done can actually help us feel good, and hobbies are great for this kind of thing, doing puzzles and that sort of thing. Meaningful engagement. This is something we've talked about in terms of decreasing isolation, having meaningful interactions with others. And you all are in this mix of meaningful engagement, of being able to have interactions that really do uplift and have meaning for our patients. Next slide. So thinking about fostering a supportive community and social connections, this is harking back to what Dr. Manst talked about. We cannot say it enough. It's so, so important for our patients. And so if you're concerned about a patient, you can ask about their social network and supports and be connecting them with resources that we're going to talk about next. Next slide. In our interactions with patients, we can promote resilience and have helpful interactions with them. and they matter. And I can speak from experience that decades later, they can be remembered in a very positive way, and they can be very uplifting. So small things, really listening to the patient, and that can be hard to do when we're really time compressed. But patients really feel it when we listen to them, acknowledging their strengths, their progress. If they've been missing a lot of appointments, I've noticed that you have made 3 appointments in a row. This is really amazing. This is great that you're doing this. How are you feeling about that? Are you noticing that? Clarifying options in treatment so that they are really understanding what their options are and they feel empowered to make those decisions. Encouraging questions. Do you have questions for me? What are your questions? If you have questions later, please come back, bring them back to me. Also demonstrating caring and kindness, which is one of the things I love most about working at UI Health, is everybody is so caring and kind. And patients really do feel that warmth, and it makes a difference. Normalizing distress, if you're seeing that, and also normalizing the need for support. Next slide. So in connecting patients with support, we're often thinking about long-term therapy, psychiatric care, and we can do that through direct referrals. Psychology today is a very powerful search engine where patients can search for both a therapist or a psychiatrist. They have all kinds of filters by zip code, by insurance. So it's something to keep in mind. We do have, for those of you that are in Epic, there is a smart phrase resource listing. If you have under Epic, there's a drop down. If you don't have my phrases, smart phrases set up, you can type it in and it'll pull up for you. And you're going to go over to facility is what you're going to click on. And then you're going to type in resources, and it will come up with a MR resource all for just this amazing list of resources in Chicagoland. For psychiatric care, there is a crisis of lack of access to psychiatric care. Sometimes primary care physicians can really assist in the stopgap of either starting a patient on a psychotropic medication that might be helpful, or continuing something that's about to lapse, and then also providing referrals, as I've just mentioned. Next slide. So in connecting patients with support, we can think about cancer support services as well, in addition to therapy, support groups, individual counseling, yoga, exercise, all of these things here. And our primary partner is Wellness House. They're on site here at the OCC Cancer Clinic. And we want to utilize these free services, connect our patients with them. Wellness House has in-person programs at the Survivorship Clinic at Mile Square, and they have virtual programs as well, and individual consultations they're able to provide here on site. And there's also Gilda's Club, which is not very far away, and they have some wonderful programs and events. Next slide. These are some additional supports for patients. So the National Association of Mental Illness, am I saying that correctly? Let me know in the chat if I did not. Has a warm line. This is 833-NAMI-CHI. And that is not 24/7, but it's a great resource for patients just to talk with somebody who has some kind of training to provide some support. Immerman Angels is a peer mentoring program to match up patients with somebody else who's going through what they're going through or went through that. And even caregivers can access Immerman Angel support. Crisis resources. We really want to make sure that patients know to call 911 if they're having a mental health crisis, especially if we have any concerns about suicidal ideation, that they're not calling the clinic, they're actually, calling 911. This is what we want. There's also the suicide helpline, which recently changed to this very nice 988 number. And that's 24/7. They're wonderful. And the crisis text line, where you can text this number and get some support via text. Next slide. Caregiver support. Just wanted to mention that caregivers carry a heavy load, and they are in need of support. And so to please connect them also with the kinds of resources that we have talked about. Next slide. Self-care for professionals. So you all are caregivers too. I called a hospital recently and they said, we will connect you with a caregiver shortly. Right. We're all caregivers too. So think about that. And I know you all do think of yourselves in that way, but in the sense that you need support too. Quality self-care is essential for quality patient care. It really is, so that we can be at our best. And some simple strategies that can make a big difference at work, taking mindful breaks. So many of us do not have the benefit of a window in our workspace. So if we can even go to a space where we can see outside and take a moment just to look and to notice, that's a mindful break, and it can really, really be helpful. Research shows that taking any breaks during the day actually makes us more productive, even though it takes a little time to take the break. Desk stretches can really help us feel a little bit more relaxed and be able to kind of retune. Taking short walks down, hallways, upstairs, whatever we can manage. And then away from work, thinking about those 4 M's for ourselves. If you're feeling a little bit down, if you're feeling a little overwhelmed, you feel like you're dragging, think about those 4 areas and where might you beef up your self-care. Addressing compassion fatigue, noticing if you're really thinking about patients a lot, if you're holding that, and maybe getting support through our own EAP program here, or talking with your supervisor about that, or a trusted colleague, or anybody in your life that you feel might be able to provide support, including mental health support, because we need to give ourselves permission to reach out for that support when needed. Laughter is great medicine. That's actually a research-based statement. So if we can find some joyful moments, some times of laughter, and even when we have those moments of laughter with our patients, you're a part of their healing journey in that way. And to be able to do that for yourself and be thinking about what are the things that I can do that bring me joy might really make me laugh and feel, this kind of opposite feeling of that happiness. Next slide. So I'm going to turn it back over to Dr. Manst to wrap us up. Thank you.
Thank you so much, Jill, for all of that. I'm just gonna, wrap it up a little bit, talk about what's currently happening in this realm. It's more health systems seem to be implementing these distress screeners into continuity visits for cancer survivors. I know it's something on our docket in survivorship, and Jill and her social work team are doing this. So something to continue to work on. Also, IDPH, the Illinois Department of Public Health, is offering a funding opportunity to expand quality psychosocial programming across Illinois, which Wellness House, again, has applied for. And we're waiting to talk more about that. And then growth of community organizations and partnerships with healthcare systems. So strengthening these partnerships with all those groups like Immerman Angels or the American Cancer Society. So different things we want to think about. I also wanted to talk about a few clinical trials that are happening at UIC. There are many others. If you're like me, you get an email at least once a week about looking for participants. And what I got yesterday was a Spark 2 trial for adults with depression or anxiety. So you can reference back. I'll send out these slides and you can look at this for more information for problem-based solving with depression. The Enhancing Connections palliative care trial is something the survivorship team is intimately involved in, helping parents with terminal cancer in being able to connect better and discuss their cancer diagnosis with their children. So if that's something any of your patients fit into, you can find more information here. And then also we talked about how disability is something that can change a patient's mental health, especially on top of cancer. And the We Can Manage application is developed here at UIC. And I think the contact information is in here to learn more about that. So just some takeaways. Cancer and cancer treatment obviously cause significant mental health problems, myriad of problems. And survivorship is a very emotional journey, and it's different for every survivor. But we need to screen for this distress and mental health concern, because, like Jill said, not everyone is forthcoming with it. But we can do things to help promote better outcomes. There are many strategies and resources that exist that support cancer survivors' well-being. And finally, it's important to offer support to anyone you know who is going through or helping another with cancer. So cancer survivors, caregivers, your fellow colleagues here at this lecture. Professionals need self-care too. So we want you, if you're interested in connecting, share your email in the chat. If you want to help us to address mental health needs of our patients better, we want to all work together to promote patient care and make it the best it can be. We also included all of our references here. And thank you very much, everyone. And I'll open it up. We have about 10 minutes for some questions. Anyone have a question? You can take yourself off mute.
Good morning, everyone.
Hi.
Thank you so much for the wonderful presentation. The one question I'm wondering, and I know, this is probably something that happens often. Really, thank you so much for the wonderful presentations. I'm wondering if you both can share a bit about what you do to kind of demystify the experience of mental health, and what are some of the strategies that you have found most helpful in guiding people to programs, right? I'm just aware that sometimes it's a cancer diagnosis and the subsequent challenges that come emotionally, where people are, for the first time, faced with trying to do something about it. And would love to hear both from you, Dr. Manst and Jill, about what are some of the things that you have found helpful to kind of demystify the benefits of getting support.
Yeah.
Simply.
Thanks, Meganette, for that question. It's definitely, speaking with cancer survivors, it's a hard population because a lot, and especially at UIC, I will say, because a lot of our patients come from an underserved population. So they hesitate to speak about such things. And a lot of them just don't acknowledge the fact that they could benefit from help and don't know that resources exist. They think, oh, this is just something I deal with. And so it's that, helping patients to recognize, like, how would life improve if you had such a thing in your life, and to be able to connect them to programs that they're like, wow, this actually is really helpful. Sometimes that can be hard. It can be hard just getting them into survivorship. Sometimes they say, I don't want another doctor, I don't want another appointment, and patients really have to be ready for it. But yes, it's just helping patients to understand that resources exist, they are not alone, and that we can help them out. Jill, do you have anything else to add?
Yeah, I would say all of the above. And then also, I really just try to bring services to life, Meganette. So I ask, have you ever thought about this? And if not, I do explore their trepidation about it, their concerns, their worries about maybe connecting with whatever resources in mind, right? But if we're thinking about programs specifically, I really like to present the buffet and see, and there's no judgments if they're not interested in anything, because it's helpful for them to have that information now, and they might want to actually engage later. So there are no shoulds. It's just trying to bring it to life. So are you thinking about maybe a support group? Do you wonder what that might be like? And they're often able to articulate and say, I just can't listen to anybody else's problems right now. I just cannot hear it. Okay, then what do you think about stress management? That makes sense. And it's good that you're thinking about, what might work for you and what wouldn't. What about stress management programs and relaxation or other kinds of things, exercise, movement, nutrition classes, things of that nature, and let it sit, like let them try it on mentally and see if that seems like a good idea. And then I encourage them to just give it a try, because if they, try it one time and it doesn't resonate, then it's probably not the right resource for them right now. But then they know it's there. They can come back to that resource later. So there's not a long-term commitment. And I think that's one of the concerns too, is that they're going to get pulled into this thing that they can't get out of, right? And it might be bad, so understandable anxiety about the unknown. So those are some thoughts.
Yeah, having a big toolbox. Different things. Having a lot of different options for patients to participate in is so that patients can find what they're connected with. Dr. Sims, good morning. Thanks for coming.
Hi, good morning. I think my question is along the lines of what Majanette was just speaking about. First, thank you for this presentation and this wonderful work, and thank you all for what you're doing. But my observation is, in general, we have a paucity of mental health providers and support for that care, and then specifically a paucity of diverse mental health providers, and along the lines of what Majanette was speaking about or getting to, how do we incorporate that, particularly in a climate that really isn't supporting it? Getting funding for it, I think, is less. And I mean, just the concept of a truly integrated clinic, like I have thought for years that we should have someone in our clinic when we share the diagnosis, because that, is when it starts. And long before, even hearing those words and figuring out what you're going to do with your life after that, I think we would be able to provide better care if we looked at mental, spiritual, and physical health as, all combined. But there's no money for that. So I don't even know if I have a question other than how do we continue the beautiful work that you're doing and raise awareness about why funding for this is actually going to make people better.
Right. That is a challenge. Thank you, Dr. Sims. And that's exactly why we wanted to talk about this today and bring this up and bring people together so that we can work together to try to change things like that and bring, social workers and mental health professionals, psychiatry visits into the clinic. These are things we need to talk about to get advanced, right? And so, I mean, as far as getting funding and things, just publishing some results of, how that impacts patients is always helpful. But yeah, Jill, do you have any other thoughts on this? I feel like this would be good might be in your realm.
Right. Yeah, well, the funding, oh my goodness. It would be amazing and needed, especially as the trajectory is going up. We're following the same trajectory as overall mental health concerns since COVID in the cancer impacts realm. So depression in particular is really on the rise, and but really kind of referencing to the availability of mental health clinicians and mental health clinicians that really that are relatable and are of the community, or can have an understanding of the impacts that patient might be experiencing, is a huge need. So one of the reasons why I love the Psychology Today search engine, because what you come up with is a list of bios with photos, right? So you can just see at a glance, am I drawn to that clinician? And that can be something that's really helpful, and read about their approach. You know, that do they talk about things that are that that relate to me in my life? Would they maybe understand the social context of what I'm experiencing?
I was just going to add too, Jill, that our kind of integrated model of collaborating for Wellness House to have staff on site. So Dr. Sims, it's great to see you. I owe you a follow-up, first of all, just to say that, but to say, you know, we have our Maria Quintana Diaz, who's actually on the call today, and she's our bilingual community relations advocate. And so she is on site at UI Health and Survivorship Clinic and at the OCC, highlighting our programs. And so to do all the things that Dr. Manst and Jill are sharing, so much easier to do by way of a relationship, right? And so great to be able to introduce Maria and in folks' own language, and to have folks that share a similar cultural background is a way to kind of break some of the barriers that we have noticed. So that's a step, right, in the right direction.
Yeah.
Mm-hmm.
Also, Dr. Nikki Gastala at Miles Square Health Center. I don't know if you know her. She has done wonders for behavioral health at Miles Square. In that it's not the cancer location at UIH, but we have our survivorship clinic there, and the social workers are right down the hall. And there was a couple of patients that I've talked to and been like, hey, do you want to talk to someone like right now? And I totally agree with you. That's what's needed, a diagnosis. But she has done some great work in the clinic there. She may be someone to, bring into this talk, this discussion about how we can continue to improve that and try to find our champions at the OCC to bring that to cancer patients when they're receiving that very diagnosis. Yeah. Anyone else have anything else? Let's see, Betty completely agrees with you. Of course you do, Betty.
And I can make some quick comments.
Yeah.
I realize, and to your point, Dr. Sims, it does cost money. And we would need research to validate the fact that if you provided that at diagnosis, that's going to reduce end costs at the end, which we probably all know it does. But at the very least, connecting at diagnosis, everything is crazy, right? And they're not fully absorbing, but connecting them to other people like them, whether it's through Immerman Angels or through organizations such as Wellness House, is huge. They may not be able to do it at diagnosis, but as long as they keep getting reminders that those resources exist through the course of their cancer trajectory, it will help at some point when they're ready, hugely.
Absolutely.
So thank you guys for all you do in that realm.
Yes.
Thank you, Betty. Yeah, definitely. Our providers in clinic, I believe Dr. Ganshaw is here, maybe. We like to ask their patients periodically every couple of visits if we've gotten a no before and say, hey, has anything changed? Would you be interested in connecting with some resources? But it's meeting patients where they're at. So some of them are just not receptive to that. I realize it is 10, so folks have to leave, but if you don't, we can continue discussing. I'm happy to discuss until everyone wants to go. So are there any other questions or comments from anyone else? I think folks are just starting to head out. Well, thank you, Jill, so much for working with me on this presentation. And thanks
you,
everyone for attending. This has been a great start to the year, and I hope it sets the tone for some work going forward at UIH. All right, thanks everybody.